Back in the studio with Dr. David Klein of the Stages of Life. I want you to go ahead and visit right after this show. Visit suffernomore.com, suffernomore.com, and get involved in a nutraceutical program that keeps them coming to you on time with a discount, and that's Stages of Life Vitamins.com, Stages of Life Vitamins.com. All right, today we're talking about GI health and Alzheimer's, and I don't think that we're talking about the military here.
You got it. Okay. Well, here's the interesting thing that I want to convey to you today. This is going to be a 10-minute segment that is going to change the way you think, quite literally, as it turns out. And we're all looking at Alzheimer's disease, trying to figure out how we can keep this from happening to us, how we can keep it from happening to our parents, or our children for that matter. And the children are actually more interesting in this regard. And so what does the gastrointestinal tract have to do with Alzheimer's? Okay, and we're going to be discussing this in a couple other segments as well from a different angle. Gastrointestinal tract has a tremendous impact on the way you think. And if you don't believe it, okay, we can take something as simple as a glass of wine. Okay, people use substances and have for years to change the way they think. Okay, what happens in the gut makes you feel better. There are feel-good foods, wouldn't you know it? You feel differently when you drink something sweet than when you drink something sour. You will feel differently, okay, after a heavy meal than you will for a light meal. You are going to feel differently when you eat ice cream than you do if you eat sour cream. It just works that way. There are things and foods that you will eat that are going to make you feel ill, and you're going to think that this is all about, eat to feel better. And the answer is yes, it is all about that, but not in the way you think. It has more to do with what's called, there's a barrier in your gut, okay, between the inner portion of the gut and the bloodstream. And this is extremely important when it comes to Alzheimer's disease. And the answer is where, or the question really is where, and the answer is why. Okay, you have bacteria in the gut, most of which, the vast majority of which, are actually very healthy. They help you digest foods. They help by producing vitamins that you subsequently absorb. Very, very important to your health. Were it not for the bacteria in your gut, you'd get sick and eventually die. We have to have them. We coexist with them, and we coexist with them on a healthy basis. It is the way that it has to be. But, okay, when you develop an imbalance of these bacteria, or if you develop things that change the permeability of the gut itself to pathogens, funny things happen. Well, what happens is that these proteins start to cross-react with proteins within the brain. You start developing autoimmune disorders to the brain itself, which is thought to lead to the development of Alzheimer's disease. The data is really only 3 or 4 years old. This is out there now, and they're trying to elucidate precisely which bacteria, precisely which proteins, and precisely which autoimmune disorders lead to the development of these neurofibrillatory tangles that we call Alzheimer's disease. Well, you got people out there that'll say Alzheimer's disease is a lot like diabetes, so we're going to call it diabetes type 6. I mean, God knows. Okay, it's going to change by next week anyway. Yeah, there's an inflammatory component to it, but it may not be due to the sugar. It may not be due to the insulin. It's certainly not due to glycosylated hemoglobin A1C. No. But what it could very easily be due to is the autoimmune, these gamma globulins that the body develops as if the bacteria looked too much like a different type of foreign tissue, and your body starts to fight itself. Now, there are two membranes that have to be kept intact. One of them is in the gut, and the other one's called the blood-brain barrier. So on a day-to-day basis, we deal with our gut. On a moment-to-moment basis, we deal with it. The blood-brain barrier remains intact unless certain things happen. Trauma is a good one. You get hit on the head. Okay, it opens up the blood-brain barrier, and then these antibodies have a shot at your brain tissue. This actually may be the way Parkinson's disease develops. Okay, you see it in boxers. Now, why would you see it in boxers? Because if there's anything about a boxer's life, is they get hit onside the head repetitively. It causes damage. It opens up the little tight junctions in the membrane, the blood-brain barrier, and then all of a sudden you start to develop these autoimmune issues. Closed head injuries, traumatic brain injuries, stroke, all of these things will cause a breakdown of the blood-brain barrier. But in order for things to really go south, as it were, you have to pay less attention to what's going on to your GI tract. So what do we do to stay healthy? We get in there and treat this. Now, does this mean you have to run out and buy a probiotic? Not necessarily. Does it mean you have to run out and buy certain vitamins and minerals? The answer is no. What you have to do is to take 2 steps backwards and look at the whole picture and figure out what you're doing right and what you're doing wrong. If you have a lawn, you'll understand where I'm going to go with this, okay? Because you can feed a lawn. At the same time you're feeding a lawn, you're also feeding the weeds, right? Okay, so yeah, I'm going to go out there. I'm just going to feed the blades of grass. Well, it doesn't really work that way. You have to balance what's out there growing and what isn't something that you want to have. So you have to selectively beat back the weeds as you start to enhance the other creatures that you're working on there. So a probiotic is important. A good probiotic is essential. But what does it mean? Does it mean you take a single capsule to get the job done? The answer is no, because you have to provide nutrients. Okay, well, so you can give them the bacteria. That'll get things started, but the nutrients are different. We call these prebiotics. Okay, what's a prebiotic? A prebiotic is a food for the critters so they grow properly. If you give these bacteria too much sugar, the wrong bacteria will grow, and you're going to start to feel bad. You can see it in your skin. You can tell an individual that consumes too much sugar by the nature of their skin. This is not a lot of fun, especially if you have the vanity gene. You know, if you're looking at yourself thinking, gee, why am I looking older when my friends are not? It's not all a matter of surgery. It's a matter of what you eat. You are what you eat. But you are also what these bacteria eat. So there's a family involved here. It's not just you, but it's also the trillions of bugs in your gut, all having to sing from the same hymnal. It's an interesting thing. And then what can you do to screw up the whole family? Well, you can bring home a stranger. That'll do it. If you're having a Thanksgiving meal and you bring home a creep, okay, I don't care how well everything's going to work out, the party is going to go south. So you end up getting sick. Or let's say that you're going to make yourself sick. You cut yourself. You end up with a respiratory tract infection. My favorite ones are the viral URIs. Why? Because they're the most common. Yet, the well-meaning doc, the well-meaning PA, the well-meaning nurse practitioner, and the well-meaning mom is going to tell the doc, I want an antibiotic for this upper respiratory. I feel so bad. I need an antibiotic. And so not only are you doing something that's unnecessary, but you're killing trillions of creatures in your gut that are necessary for your health. And it's not like they're going to get better overnight. It's like swallowing a hand grenade. In order for the gut to recover, it may take a matter of months to years. But all the while you're changing the genetic memory of this pile of DNA that's floating around in your gut, self-replicating and keeping you healthy. So if you look at the total number of antibiotics that are received by any individual over the course of their lifetime, there's a direct proportion to the development of diabetes. Your risk of diabetes goes up every time you take an antibiotic. Think about that. Okay, what are you really doing? And something called damage. So Alzheimer's has a direct and a very, very direct result from what you do and what goes on in your gastrointestinal tract. Well, what else other than antibiotics? What about mouthwashes? Okay, it's something as simple as mouthwash, something as simple as the detergent in your silverware glasses. Each of these things has a subtle change in your GI environment. Now, I'm not going to tell you not to clean your silverware or your glasses or your dishes, but just understand how delicate this particular environment is. If you go ahead and you wash your dishes in the pond next door, what do you think that's going to do for the fish? You think it's going to help them? Okay, well, somebody has to wash their clothes. Well, guess what? We polluted our rivers with clean clothes for decades in this country. Okay, this is what we're doing with our mouthwashes and toothpastes. So what we have to do is to change our habits. We have to change the way we do things and learn to respect what we are and who we are. So instead of sucking down the sugar, instead of sucking down the carbohydrates and making ourselves heavy, we need to be looking at complex carbohydrates, essential fatty acids, and the proteins that are necessary to keep our health, but also to maintain the balance in our GI tract, because the development of Alzheimer's, the development of other dementias, and other chronic illnesses, which we'll go over later on this week, may depend on this.
All right, very good. You're hearing Dr. David Klein, 5 board certifications, Stages of Life Institute, just off of I-4 in Longwood. just 2 blocks. You can get all the information about the stages of life at suffernomore.com, suffernomore.com. And how about this? If you take nutraceuticals, which you actually should, we're not getting it all in our water anymore. We're not getting it from our foods anymore. There's certain things the body depends on for good health. If you've listened to this show, you've now learned that. All right. Well, how about getting your nutraceuticals delivered to you? Saves you a trip, saves you a lot of time, and it gives you a discount. So go on to the web, open up stagesoflifevitamins.com, stagesoflifevitamins.com. Just select the nutraceuticals, read up on ones you're not taking, get on a regimen of how many you'll have to take a day, and it will figure out for you how many you should have a month. And then every few weeks or a month, you're going to get a package before you run out of your nutraceuticals. Taking them for 25 days and then not for another 10 days really does you very little good. All right, we'll have the doctor back in studio again tomorrow.